Did you know that the very pill you take each morning to control your blood pressure could quietly be increasing your risk of falling? It's a surprising reality for many older adults, and one that often goes unnoticed until an accident happens. We put our trust in medications to keep us healthy and independent. But for millions of seniors, these same pills, especially when taken together, can introduce hidden dangers that aren't always obvious. As we age, our bodies change in ways that affect how we process drugs. Kidneys and liver may slow down, and our sensitivity to medications can increase, making us more vulnerable to side effects. A dose that worked perfectly at 55 might become risky or even dangerous by the time we reach 75 or 80. What once helped can now harm. Polypharmacy, taking multiple prescriptions at once, can create unpredictable effects on balance, memory, and alertness. Even a simple walk to the kitchen can become a hazard when medications interact in unexpected ways. The link between common medications and falls is a growing public health issue, yet it's often overlooked in conversations about senior safety. Many families and even some healthcare providers may not realize the risks. This isn't about blaming medicine or those who prescribe it. It's about raising awareness and starting important conversations. We need to see those little bottles as both helpers and potential risks, tools that can heal, but also things to be handled with care and knowledge. By understanding how medications contribute to falls, and by staying informed, we can take practical steps to protect our loved ones and ourselves from preventable injuries. The first step is simple but powerful. Ask the right questions about every pill, every day. Stay curious, stay cautious, and remember, your health is worth the conversation. Falls are the leading cause of injury-related death for adults over 65, according to the CDC. Every second, an older adult falls in the US, and the numbers are rising. Over the past decade, fall-related deaths among seniors have jumped by more than 30%, with prescription medications playing a major role. Nearly 40% of adults over 65 take 5 or more prescriptions, increasing the risk of dizziness and loss of balance. The very drugs meant to help can, in combination, create a perfect storm for instability. Recognizing these statistics is the first step to reversing this dangerous trend. Which medications are most likely to cause falls? Sedatives, sleeping pills, and anti-anxiety drugs like Ambien, Xanax, and Ativan top the list, causing drowsiness and confusion. Certain antidepressants, both old and new, can cause dizziness and sudden drops in blood pressure. Blood pressure medications, especially diuretics and beta blockers, can make you lightheaded when standing. Opioid painkillers, muscle relaxants, and even over-the-counter antihistamines like Benadryl can slow reaction times and impair balance. Combining these drugs multiplies the risk, turning a stable senior into someone perpetually off balance. The more medications, the greater the danger. Balance relies on your vision, inner ear, and muscle sense, all sending signals to your brain. Medications that cause drowsiness or slow reaction time disrupt this system, making it harder to catch yourself if you trip. Blood pressure drugs and some antidepressants can cause sudden drops in blood flow to the brain, leading to dizziness. Some antibiotics and high-dose aspirin can damage the inner ear, causing vertigo. Other drugs weaken muscles or nerves, making it harder to sense where your feet are. When these systems are compromised, even a minor misstep can lead to a major fall. It doesn't take much to tip the balance. Meet Arthur, 82, who lives alone in the same cozy house he's called home for decades. He's proud of his independence, managing his daily routines and enjoying the comfort of familiar surroundings. Each morning and night, Arthur carefully sorts his medications, a blood pressure pill to keep his heart steady, a sleeping aid to help him rest, and a new antidepressant prescribed after a recent bout of loneliness. One evening, as the phone rings unexpectedly, Arthur stands up quickly to answer it. The sudden movement causes his blood pressure to drop sharply, and he's still feeling groggy from his sleeping pill, which often leaves him a bit disoriented at night. The antidepressant, while helpful for his mood, sometimes makes him feel unsteady on his feet, adding to his risk. As he hurries, his foot catches on the edge of a rug, something that's happened before, but never with such consequences. This time, his slowed reflexes, dulled by medication and age, can't save him from losing his balance. Arthur falls, quietly, in the very place he feels safest, his own living room. For many seniors, the greatest danger isn't outside on busy streets or in unfamiliar places, but right at home, where everyday objects, rugs, low tables, and even medication can create hidden hazards and turn a safe haven into a minefield. Arthur's story is a reminder that small factors, like the combination of medications and a cluttered environment, can come together unexpectedly to cause a fall that could have been prevented with a few simple changes. Understanding how medications and home safety interact is key to prevention and to helping seniors like Arthur stay safe, healthy, and independent for years to come. Seniors over 75 are especially vulnerable. Aging bodies process drugs more slowly, increasing side effects like dizziness and confusion. Those on multiple medications, polypharmacy, face even higher risks, as drug interactions can amplify instability. Seniors with conditions like previous falls, inner ear problems, Parkinson's, neuropathy, arthritis, or poor vision are at greater risk. For them, even a mild medication side effect can be dangerous. Watch for warning signs: dizziness, unsteadiness, holding onto furniture, increased drowsiness, or confusion. If a loved one seems more forgetful or off balance after starting a new pill, don't ignore it. These aren't just signs of aging. They could be medication side effects. Early recognition can prevent tragedy. The good news is that medication-related falls are not just a risk we have to accept. They are preventable with the right steps and a little planning. By being proactive, we can help seniors stay safe and confident in their daily lives. One of the most important things you can do is schedule a yearly medication review with a trusted doctor or pharmacist. Be sure to bring every prescription, over-the-counter drug, and supplement. Even vitamins and herbal remedies count. This thorough review helps spot risky drug combinations, duplications, and medications that may no longer be needed. It's a simple step that can prevent dangerous side effects and reduce the risk of falls. Next, take a close look at the home environment. Fall-proofing the home is essential. Secure loose rugs, improve lighting in hallways and bathrooms, install sturdy grab bars, and keep walkways clear of clutter or obstacles. Encourage regular physical activity. Balance and strength exercises, such as Tai Chi, gentle yoga, or even simple chair squats, can greatly improve stability and confidence. These activities help maintain muscle strength and coordination, making everyday movements safer. Before starting any new exercise routine, always check with a doctor or healthcare professional. They can recommend safe activities tailored to individual needs and health conditions. Stay informed and keep the lines of communication open with healthcare providers. Ask questions, share concerns, and work together to make practical changes at home that support safety and independence. Remember, you can be the advocate your loved one needs. Your support, encouragement, and attention to detail can make all the difference in their well-being. Protecting seniors from preventable falls starts with these simple, proactive steps. Every small action adds up to a safer, more comfortable home. Together, let's make the golden years truly safe, independent, and joyful for the seniors we love.